Well, it's time now for Perspective, and it's our top story today. Just one day after Biden's inauguration, the new US administration has embarked on an ambitious plan to halt the spread of COVID-19, as the number of US deaths from the virus swells past 406,000. Well, to discuss Biden's plan, I'm joined now by George Rutherford, Professor of Epidemiology and Health Administration at the University of California, San Francisco. Thank you very much for speaking to us here on France 24. Now, we've just seen a raft of new executive orders targeting mask wearing, the vaccination rollout, a push to get more people tested more quickly. What are your first impressions of Biden's approach to the pandemic, compared, that is, to his predecessor, Donald Trump?
It's great. They're great. We have a comprehensive plan, 200 pages long. I've yet to read it, I admit, but I only got it an hour ago. So I think we're on the right track. The prior administration got the vaccine made, which is a tremendous accomplishment. But we need to deploy it. We need to get it into arms. It's not doing anybody any good sitting in freezers.
And what, in your opinion, are the major logistical challenges facing the rollout of the vaccine right now?
They're enormous. You have to, first of all, we need a constant supply, a predictable supply. So that's where the Defense Production Act comes in to ramp up production. The administration has a goal of getting 100 million doses done in the first 100 days. That's probably on the low side. And we can do, I think, many more if we just get a little bit more organized. But first and foremost, we have to have a predictable supply of vaccine.
Now, Biden's approach has stressed a national strategy, whereas Trump largely left it up to individual states to decide how best to approach the pandemic. How significant is that specific change in Biden's approach?
It's massive. It's massive. To have centralized planning, somebody who gets up every morning to think about how to stop this, and who has endless goodwill. I think it makes all the difference in the world. In the United States, public health is quite decentralized. It's the province of states. So when something like this happens, everyone looks at everyone else. I think it's terrific that the federal government is now going to take an even greater leadership role and really try and get everybody on the same page.
And are you expecting any pushback from states that traditionally tend to resist federal interference?
Maybe. But, California is not one of those. And so we're really looking forward to having centralized planning and a centralized supply of vaccine, which has always been centralized, and the funding to get it done.
Now, it's one thing to get the vaccine rolled out, but of course people need to be willing to be vaccinated. How concerned are you about vaccine skepticism in the United States?
Somewhat. And the interesting thing is that it breaks down along racial and ethnic lines as well, so that the African American population which has been historically underserved, as you're all painfully aware, is somewhat more. African Americans are somewhat more resistant or more hesitant to get vaccine. I think that we can make that problem with some reassurance. I think we can move forward on that. But we need to get to herd immunity, and to get herd immunity, we can't have 40% of the population saying they're not going to get vaccinated. 5%, okay. But, we need to get to 70-80% of the population vaccinated or naturally immune before we're going to achieve herd immunity.
So you talk about reassuring people, but what does that really mean concretely? How do you convince someone who doesn't want to get the jab to get vaccinated?
It's not that they don't want to get it, it's that they're hesitant to get it. And it's about tipping people over with data. With experience, that we know exactly what's going on, with transparency about any problems that may come down the line, and by probably a large advertising campaign to encourage people to get vaccinated. It's a subtle. It has to be fairly. It's a subtle difference between people who are saying, maybe I'll just wait and see how it goes with everybody else, versus saying, I'll go to my grave without ever getting vaccinated against anything. It's that first group that we're really interested in trying to get them vaccinated and get moving.
Now, we are hearing a lot about the threat posed by a new and more contagious strain of the virus, or I should rather say strains of the virus. How worried should we be, do you think?
Somewhat, but the more we look, viruses mutate. That's what they do, right? So the more we look, the more we're going to find. And we've had a major shift in the type of virus that causes COVID-19 in March and April, and no one really paid very much attention to it. Where we went from a Chinese strain to a European strain, and now we're probably going to have a shift, maybe to this English strain. We think that that in the U.S. this will become the predominant strain by May. The new UK variant will become the predominant strain by May. What does that really mean? The vaccine still works, masks still work, social distancing still works. It's the same stuff we're doing now. We may have to do it faster, which is why it's great to have centralized planning, centralized production, and centralized purchasing of vaccine, and the Defense Production Act that can compel manufacturers to ramp up stuff.
Now, you've heard from Dr. Fauci, the Biden administration chief medical advisor, who's been rather frank about the challenges he faced working with Trump. Let's just take a listen. Do stay with us. We'll come back to you in a second.
It was very clear that there were things that were said, be it regarding things like hydroxychloroquine and other things like that, that really was uncomfortable because they were not based on scientific fact. I can tell you, I take no pleasure at all in being in a situation of contradicting the president. So it was really something that you didn't feel that you could actually say something and there wouldn't be any repercussions about it.
The implication there being that Trump did do some real damage to the perception of the virus among Americans. Do you think the Biden administration is going to be enough to reassure people, to convince people to take the measures that we've heard Biden outline in the last few hours?
The majority, yes. And I mean, there are always going to be bitter enders who are going to, cling to their beliefs till the end of time. But I think I think the Biden administration is sincere. I think their sincerity is compelling, and I think the vast majority of the scientific community is going to come down on its side, and we'll be able to steer this boat through this crisis.
George Rutherford, we're going to have to leave it there, unfortunately. George Rutherford, Professor of Epidemiology, thank you very much indeed for speaking to us here on France 24 today.
My pleasure.